Welcome to the Medical Staff Voice Live. I'm Dr. Stan Frosweig, Chief Medical Officer at Community Memorial Health System, and I'm joined today by Dr. Irene Dansby, radiology and radiologist in the mammography department. Thank you for joining us today.
Thank you for having me.
You're very welcome. We wanted you to join us today so that our medical staff and community can learn more about your practice. And the way we do that is by asking some questions that will enlighten us and give us some insight into what it is that your specialty entails. So the first thing we start with is, what's your background and where did you train?
Well, so training began at UCLA for undergrad and then USC for medical school. From there, Harbor UCLA for internship, and then UC Irvine for radiology residency. And then I ended up doing 2 fellowships. So the first was at Cedars-Sinai in body and intervention. And then my husband, Levi Dansby, who is an interventional radiologist, he matched at Northwestern for his subspecialty. And so I kind of had a free year. So with that year, I guess I just decided to contact the breast department there. They said they had a spot available, so that's how I got into breast imaging.
Wow, that was
It was very lucky, actually.
Yeah, for you and now for us.
Yes.
So you sound like you've had a great deal of experience in your field.
Yeah.
Is there some areas of subspecialty or treatments or diagnoses that you particularly want people to know about or that you particularly enjoy?
Yeah, so I mean, my subspecialty is breast cancer. So I'm a mammographer, and that's where my passion lies. Right. So, and that's what our practice focuses on. So the basic services are, screening mammography for our healthy women and that population, and then the diagnostic mammograms for women that have any sort of breast-related complaint. And then from there, we can move very fluidly into getting their breast ultrasounds done for them and any biopsy that they might need for their workup.
Very good. Now, most people don't realize this. Of course, 90+% of mammograms are on women.
Right.
But we do have men that occasionally need a mammogram.
We do see men. Occasionally, we do see the pediatric population. Every once in a while, I had, I think, 2 pediatric patients yesterday. So usually for very basic type workups, just more for reassurance most of the time that everything is okay. But we see them from the youngest to the oldest, and men and women.
You answered my next question. Thank you. That's perfect. Where's your practice located?
So we are right across the street from the old Mountain Tower in the 168 building, Suite 401.
Very good. Right across the street from the old hospital.
Mm-hmm, yeah.
Very good. And do we do breast biopsies via needle aspiration or things like that by your department?
We do. So we'll do them right there in the office. We do them with ultrasound guidance and with mammographic guidance. So just depending upon the type of lesion that we have, we'll choose the right biopsy modality for it.
That sounds wonderful, and something that as a practicing physician that we find very, very valuable is that the breast center will call the patients after the studies have been done to advise them of the results. Yeah. That's a wonderful service.
I'll talk to them right there. So if they're my patient and I'm doing a diagnostic workup, I'll scan them. I'll do whatever I need to do, after the technologist has done their job, just to double check everything and make sure that we've got everything we need. And at that point, I'll give them results and I'll talk to them if they need a biopsy, just so that they understand and hopefully put their minds at ease a little bit for the procedure.
That's the most desirable, and what a great hands-on personal service for our patients.
Yeah, definitely.
That's wonderful.
Mm-hmm.
Well, the information you've gone over is valuable, and even more valuable in light of the time of the year that it is. We know that next month is Breast Cancer Awareness Month, and we have, I think, special offers at the breast center for that month in reference to...
Yeah, so in October, we do typically offer a low-cost mammogram for women. And you can just contact us and we'll give you more information about it.
That's wonderful. And I want to mention, I do appreciate, although some physicians might not feel as much this way, but I love it that a woman can call up and without a physician's order, schedule her mammogram.
Yes.
That's a great service.
Yes, there is only one caveat to that, and that does have to be on the screening side. So as long as there are no symptoms, it's fine. Otherwise, we do want a supervising physician.
I'm glad you clarified that.
Mm-hmm.
That's a critical point. We've talked about the serious aspects of what you do, and we really appreciate your service. In addition to that, I'm sure you have outside interests or hobbies.
Right.
What might those be?
In all my free time. Right. My 3-year-old pretty much takes up all of my free time. So, which I love. I mean, obviously I adore my son. He's the cutest thing. But when we do have a little extra free time, it's usually, pre-COVID, I guess, going to concerts and, wine tasting and just things like that. But we also try to stay pretty active. So both of us winter sports and tennis and just trying to keep the body, healthy.
So you do get out there, huh?
We try to.
You haven't started bungee jumping or?
Oh my gosh, no.
Or,
there's
skydiving
absolutely no way I could ever talk my husband into that. Not a chance.
In that case, let's see if we can understand a little bit more about your attitudes towards things. And so we lighten this up one more step by going into what we call this or that.
Okay.
So we have just a few questions. Podcast or reading a book?
Oh, reading a book.
Nice.
Sure.
Nice. That's traditional. Passenger or driver?
These days, passenger. I would have answered differently a few years ago.
Very good. Night owl or early bird?
That's another question that would have been answered the opposite way. So now I'm an early bird, mainly because of my son. So I like to get up with him.
Those children change our lives.
Yes, they do, right? But I used to stay up to ungodly hours in the night when I was younger.
Very nice. French fries or onion rings?
French fries.
Good for you. Time machine or magic wand?
Oh, that's a good one. I'm going to say magic wand.
That seems to be a prevailing sentiment. Laundry or dirty dishes?
Ooh, probably laundry.
Skydive or bungee jumping?
I think skydiving, because at first you have someone attached to you, so you can, I don't have to worry about me doing anything wrong.
Phone calls or text messages?
Depends on the person.
Good answer. I like that.
I'll leave it at that.
And finally, be invisible or read minds?
Or fly. If I had a superpower, I think I'd choose to fly, because that just seems like it would be the coolest thing ever. But do I really want to know what people are thinking all the time? And I feel like you could do that with both. So I'm going to choose flying.
Good for you. I like that. Innovation. Well, that's perfect. Thank you. I really enjoyed those answers. Thank you for tuning in to learn more about Dr. Irene Dansby. For more information on all the services and specialties offered at Community Memorial Health System, visit cmhshealth.org and be sure to like and subscribe for more from your community health system. Thank you so much.
Thank you.
You're welcome.